Joining me right now are our health experts on the show. Dr. V. Rajasekhar is a senior consultant, interventional cardiologist at Yashoda Hospitals in Hyderabad. Dr. Rajeev Jayadevan is a former president of IMA Kochi. Thank you so much both for your time and thank you for waiting so patiently as we're getting our viewers up to speed with the very latest developments. From the very beginning, Dr. Rajeev Jayadevan, this question is to you. There have been questions about what has happened. Sources have told us, of course, the post-mortem report is yet to be out, but that he has succumbed to a massive cardiac arrest. I want to know from you, what are the possibilities of this with the 53-year-old, and looking at the conditions before he felt uneasy and when he felt uneasy, what do you think could have gone wrong? Dr. Jayadevan.
Yes, Sneha, it's a very tragic day. I must say that up front. Your question is about what could have gone wrong. I'll say that before an autopsy report comes, it would be wrong to talk about the cause of death. But we can have a general discussion about the common causes of death in that age group. So this is specifically not about KK. Now, we know that KK looked young, vigorous, fit, healthy, and performed continuously for 2 days. And until the time he was taken away from stage, he looked perfectly vigorous. The last fleeting glimpse I got was that of a dizzy-looking individual being taken off to the venue, possibly to the hotel. I do not know if they went to the hospital directly or not.
They went to the hotel, and then from the hotel they went to the hospital.
Okay. So these are the events that we know of. And in terms of how common death is, I'll tell you, there are a couple of statistics I want to run through with you. The first is a study from India that looked at a cohort of a large number of individuals in 8 villages. They tracked these individuals over a period of time, and they found that the odds of death, or the chance of death, is about it's actually quite small, 250 out of 100,000 in a year in KK's age group. Now, the rate of death is different in different age groups. So that translates roughly to saying, if you have 100,000 people in that age group, 99,750 are still alive at the end of the year. That's the way I would put it. The second is a large study from Canada that looked specifically at individuals that fit KK's profile. That's people who are young, healthy, and with no apparent risk factors. The chance of such a person getting a cardiac event, I know my colleague Dr. Rajasekhar is here, he will know better, but I'll tell you, the chance of such an event occurring in such a healthy individual is 1 in 20,000. That's incredibly rare. So I know many viewers will be grief-stricken and also panic-stricken looking at young, fit individuals who've just passed away. So my message will be, A, let's wait for the autopsy report to see what exactly happened over here. Second is there is no need to panic for the general public in terms of what happened today.
Dr. Rajasekhar, I want to ask you, heat stroke is what a lot of people are talking about, given that a lot has been said about this overcrowded concert hall, which was full to its capacity and beyond, and that he was extremely uncomfortable. We've seen a visual of him, this video in which he picks up a towel, wipes his head, wipes his face, visibly uncomfortable as well. I want to ask you that there is always a possibility of a heat stroke then triggering a cardiac arrest. In this case, is that a possibility as well that we could look at?
Well, from the sequence of events that have been described, as Dr. Jayadevan has very rightly pointed out, it is very difficult to make a specific conjecture on what exactly happened to KK. I mean, it's a sad thing, but we can make some scientific, assumptions based on whatever information we have in the scientific data. One is he was obviously uncomfortable and he was feeling dizzy or uncomfortable. And it is known that people who have a heart attack, almost 50% of them have some kind of a warning symptom, which unfortunately quite often is ignored. They have a warning symptom at least 24 hours prior to the index event. And whatever symptoms he was apparently feeling could be some kind of a warning symptom for an impending heart attack. It's just a conjecture, it's pure guesswork because we were not there and we have not actually seen him. And when somebody is having this kind of symptoms, staying in a crowded environment which is hot and humid would actually make him feel worse. So whether the actual heat and the crowd and the humidity caused the heart attack is extremely difficult to say.
Okay.
Then what we can definitely say is that if somebody is having symptoms of an impending heart attack, this kind of an environment would obviously make him feel worse. And what is important in this situation is that when somebody has symptoms, we have to immediately seek medical attention. And we should not ignore, regardless of the profile of the individual, regardless of the prior health status of the individual, regardless of what the general level of fitness of the individual. Because it is known that though extremely rare, a heart attack can strike down an individual in the prime of his life without any prior warning. This, in spite of the fact that the individual may not have had any risk factors, any identified risk factors. We do not know of certain risk factors which are not identified easily.
Okay.
So we do not know his genetic status, and we don't know whether he's had a genetic predisposition for a premature heart attack. But these are all matter of surmise.
Yes. You spoke about the risk factors. I just want to bring in Dr. Jayadevan again. An ICMR study has spoken about risk factors of cardiovascular disease, where hypertension is one of the biggest risk factors. The fact of the matter is that as per the ICMR survey, Dr. Jayadevan, 72% of Indians who have hypertension do not even know that they are hypertense. Basically, the level of awareness is very, very poor when it comes to this disease.
Yes, hypertension is one of those diseases that has no symptoms, and therefore it escapes attention unless the person goes to the family doctor and gets the checkup or monitors his or her own blood pressure on their own. So definitely all adults must undergo at least a blood pressure examination as a screening examination. Screening is a term that we use for people in apparent good health to check for easily identifiable health conditions. For example, as you rightly pointed out, hypertension is one of the diseases that if you pick it up early, there are effective and economical treatments for it which can reduce your risk in the long run. In fact, it can cause strokes, and as you said, it can also lead to cardiac events. But that being said, I'll tell you, just because someone looks well, as Dr. Rajeev said, just because someone looks well, it does not mean that that person does not have a heart disease. And, I see comments like, he looked fit, how can he have it? No. If you ask experts like Dr. Rajasekhar, he'll tell you, a large number of people with cardiac disease, they look perfectly fit and they may have a six-pack or they may be going to the gym. So as he rightly said, the right thing to do is to seek medical attention. And if somebody collapses, I think the whole country must be taught how to do CPR. Some of us back over here where I live in, we've been working very hard on teaching CPR skills to the community. In fact, we've entered the Guinness Book of Records from the IMA unit here for training 28,000 school children on CPR. Basically, CPR for our viewers, if somebody collapses in front of you, do you know how to revive them? It's a very simple thing to do, but these are things that I think our community must learn as an essential life skill.
Essential life skill. I really think that is what is missing. Dr. Rajasekhar, essentially when it comes to his basic awareness and knowledge about heart ailments and discomfort. It's happened in the case of well-known actor Siddharth Shukla as well, where people have said that he in fact indeed had a cardiac arrest, but he thought it was some sort of a discomfort because of what he had eaten, and that he really brushed it under the carpet. While overreaction clearly is not desirable, but I think the level of awareness is very, very poor, and that is reflective in the ICMR study as well. Do tell our viewers what should be done, what are the telltale signs, if at all a person is susceptible. How does the person know that he or she is susceptible to heart ailments?
Whenever somebody experiences a symptom that's extremely unusual for him, like unusual suffocation, unusual heaviness in the chest, extreme weakness, accompanied by a lot of sweating and perspiration, and sudden onset of breathing difficulty, sudden dizziness, any of these symptoms, or it may sometimes just feel like some kind of an indigestion. So anything like this, which is unusual for an individual who is otherwise healthy, should ring the alarm bells. So in fact, it is said lucky are those for whom the bell rings before it tolls. So it's important that when somebody has this kind of a premonitory warning symptom, they should immediately seek medical attention. You should go to the nearest medical center or hospital, get an EKG done. The EKG is a very simple, inexpensive and easily procured investigation, which will often tell you if the person is having a heart attack. So when in doubt, we should immediately rush to the hospital. In this case, what could have been done differently? Maybe when KK complained of the symptoms, instead of going to the hotel, he should have been straight away driven to a hospital, and maybe we could have made a difference between life and death. But that's only pure guesswork. It's always wiser on the hindsight. But I think going forward, I think what I would tell everybody is that there should be no reason for panic, and people should not just go down and then go on to get expensive investigations just with the fear of getting a heart attack tomorrow. What is important is to listen to your body, to be sensitive to how your body is responding to a certain situation. And we are all wise and intelligent people, and we should realize when quite often our body is telling us if something is wrong.
Yes.
Respond to those cues, and you have to go and seek medical attention as soon as possible. Because
yes, I think you made a very important point, Dr. Rajasekhar, that our body gives us the signals, gives us the signs, but often we tend to ignore it, and that's where the problem really starts. You did also mention that there is no need to rush for these expensive tests just because there would be a sense of panic that younger men are dying because of heart attacks and cardiac arrest. But also, just to give us an idea about what should be done as a preemptive sort of a measure to ensure that you are not in a similar situation. Also, I'm going to talk a little more about what could have been done better at this venue. What about medical health? What about ambulance? What about CPR? It was a huge function of over 5,000 to 6,000 people. Why were these facilities missing? I'll come back on that. But first to you, Dr. Rajasekhar, on what steps should be taken to ensure that we don't find ourselves in a similar situation.
Yes, that's where we come in. We speak about preventive health checkup. And we recommend everybody beyond a certain age, usually anybody who's beyond 50, or if somebody has got multiple risk factors, is beyond 40 also, we recommend that they undergo preventive health checkup, which can be in the form of looking at their blood cholesterol, looking at blood sugars, getting for blood pressure, getting them checked up for blood pressure, and then see a general physician and who will make a review of the overall clinical condition, clinical health, and decide if more specific and more advanced investigations are required. So that's the first step. So the second step is what could have been done. The second question is what could have been done at the venue and what kind of facilities. There's actually, if you look at a lot of evolved and developed countries, in any place where there's a mass congregation, there will be facilities for emergency CPR and resuscitation. There's a device called an automatic external defibrillator. And if you look at a lot of airports, a lot of stadiums all over the world, and a lot of places, convention centers, they are equipped with these AEDs. That is, if a person has a sudden collapse. Usually when this sudden kind of collapse occurs, it's usually because the heart stops beating. And that's because of an erratic form of heartbeat called ventricular fibrillation.
Okay.
And innocent, this is what you call a bystander CPR. So anybody who's standing by, if he's trained in basic cardiopulmonary resuscitation, bystander CPR can save a lot of lives. And as Dr. Jayadevan has pointed out, this is experience in training the lay public in CPR, in basic CPR skills. And that's one thing that we have to do as a society. And of course, in any event or congregation where a huge number of people are going to be brought together, we need to have some ambulance standby. We need to have some basic infrastructure in place to do emergency resuscitation. And these are all policy issues that the policymakers
Yes, these are policy issues, and blame game has also started, but we are not concerned with the blame game. We are concerned with the protocol, and that seems to have not been followed, Dr. Rajeev Jayadevan. In this case, I want to really ask you, just tell me how many Indians would actually know how to do CPR and how important really is it for all of us to learn it? I mean, I'm guilty of not knowing how to do it, Dr. Jayadevan.
It's a very good question. There's no data available on how many Indians know how to do this, but I'll tell you it will be very, very small from experience. The second point is that even if you train somebody with CPR, people forget. People forget how to do this, and you load them with so much information, and these are commonly lay people. And when the actual event happens, say 6 months or 2 years later, they might not remember what to do. So it's important for people to stay up to date with these skills, go for refresher courses, at least check YouTube videos. There's plenty of information available out there on YouTube that will keep our skills sharp. And second is to teach people around you how to do CPRs, because if it happens to you, if you know how to do CPR, you can't save yourself. So it's important for every office, every establishment to have CPR courses. These are not expensive. These are done by voluntary organizations like IMA and all other doctors' organizations. They teach them. It's just a day's course, but it's very important. As I must repeat myself, you must go for a refresher course.
Yes.
And I'll give you a simple one-sentence summary about CPR, and this is helpful for people who've gone through CPR courses. If you see someone collapse in front of you and is lying down without breathing and is not able to speak, start CPR immediately. No questions asked. Start CPR and then call an ambulance. Commonly, we see the opposite. People run helter-skelter. They go fix some water, throw some water on the person's face. By the time the vital minute of opportunity is gone, and by the time the ambulance comes, you're transferring a person who's brain dead to hospital. And that commonly happens in India. In fact, it happened in my town to a young doctor that prompted me to write this article on what happens to young people with heart attacks. The second thing about investigations, I'm glad Dr. Rajasekhar mentioned about unwarranted investigations. I'll tell you this. Investigations have certain accuracy rates which are not fixed. I know it's complicated statistics here.
Yes.
Which is why Dr. Rajasekhar said you must go with your doctor's recommendation, preferably your family doctor, who will look at your entire profile and then recommend. It's not up to you to go to a shop and buy investigations. Unfortunately, that's the way medicine is practiced in India. I'll tell you why. If you take the treadmill test, the commonly done test for the heart test, do you know that 30 out of 100 can turn a false positive in a healthy person? Yes. The specificity of this test is only 70%, which means that you're going to draw these 30 out of 100 people for unnecessary additional investigations, which can have complications. So which is why it's always better to go with your doctor's advice rather than go shopping for investigations.
All right, that's an important point that you made, Dr. Jayadevan. Do not go shopping for investigations or invest in extremely expensive tests. There is no sense, there's no need to panic, but yes, we have to be extremely cautious and more than that, aware. Could have that journey from the concert hall to the hospital instead of the hotel save the life of KK? That's a question before all of us. Doctors say that every second matters if it all is a heart stroke. Viewers, the post-mortem report is not out, but the opinion generally is, in the sense is that what doctors in SSKM have been suggesting is that it could have been a massive cardiac arrest. I'm going to thank my guests, our experts here, Dr. Rajasekhar and also Dr. Jayadevan, for joining us and sharing your views with us. That is it from me in this edition, our special broadcast on what could have happened to KK and what really killed him. We'll continue to keep our conversations centric around heart disease and heart ailments.